Welcome to another video. In this video I'm going to talk about the muscles of the pelvic girdle and the thigh. So the muscles of the pelvic girdle pass from the pelvic girdle to the femur, as you see in these pictures. Muscles are classified according to their attachment to the femur. So for instance, you have the anterior pelvic muscles which attaches to the lesser trochanter of the femur, and the posterior pelvic muscles which attach to the greater trochanter on the femur. So I'll start with the anterior pelvic muscles. The anterior pelvic muscles consist of two muscles, Iliopsoas and Musculus Psoas minor. And the Iliopsoas consists of two muscles again. This is Iliacus and Musculus Psoas major. And you might be wondering why Musculus Psoas major and Musculus Psoas minor is not together. That is because Musculus Iliacus and Psoas major has the same insertion point, also the same functions. So I'll start with the Iliopsoas. The Musculus Iliacus is one of the two muscles. It originates from Fossa Iliaca. If you remember where Fossa Iliaca is from anatomy, it's going to be right here. And Musculus Psoas major, which is going to originate from the vertebrae T12 to L5, and it's going to be purple in this picture. And the insertion of these two muscles is going to be trochanter minor, and the function of these muscles is to flex the femur, adduct it to the midline, also rotate externally when these two muscles fibers contract. The femur is gonna go this direction. All right, also gonna flex the trunci because the muscle is attached to the vertebrae. You also have Musculus Psoas minor, highlighted in yellow in this picture. It's gonna originate from T12 to L1, as you see here, and inserts at Eminencia iliopubica, which lies between the iliac part of the hip bone and the pubic part. And the function of this muscle is flexio trunci because this muscle is attached to the vertebrae again. And then going over to the posterior pelvic muscles. The posterior pelvic muscles, remember, we said that most of these muscles can attach to the greater trochanter. You have Gluteus Maximus, Medius, Minimus, that's three muscles. Tensor, Fascia laterale, 4. Musculus piriformis, that's 5. You have Obturator internus externus, that's 7. And you have Musculus gemellus superior inferior, that's 9. And also Musculus quadrator femoris, that's 10. So we'll start with Gluteus Maximus. Gluteus Maximus has actually different origin points, it's gonna first originate from Fascies Glutea. If you remember where Fascies Glutea is, it's gonna be right about here, as you see in these pictures, or here. And more specifically, it's gonna originate behind linea glutea posterior. So if this is linea glutea anterior, this is linea glutea posterior, and this is where it's gonna originate from. And it's gonna also originate from the posterior surface of the sacrum and coccyges. And you see here, this is sacrum and coccyges. You can't really see it in this picture, but it's attached there. And it's also gonna attach to Ligamentum Sacrotuberale. If you remember where Sacrotuberale goes, it goes from the sacrum to the tuberositatis. Also gonna originate from Fascia thoracolumbaris. I've talked about this one in an earlier video about the muscles of the back. This muscle is gonna insert at the Tuberositas glutea, right about here, and the tractus iliotibialis, which is gonna be kind of long fibrous reinforcement of fascia lata. Fascia lata is a deep fascia that surrounds the thigh. I'm gonna make a video about this in the future. And the function of this muscle is extension of the femur, rotation externally, and also abduction of the femur. I'll go over to Gluteus Medius. Gluteus Medius can originate from Fascies Glutea, more specifically between linea glutea anterior and posterior. So this is anterior linea glutea, this is posterior, it's going to originate around here, and it's going to insert at Trocheanter major, the greater trochanter of the femur. And the function of this muscle is to abduct the femur, also rotate it internally and externally according to which muscle fibers that are contracted. And you can see the gluteus medius here. It's actually located behind the gluteus maximus, and you can also see a little bit of it on the top. Now going over to gluteus minimus, which can lie behind gluteus maximus and medius. This muscle originates from Fascies Glutea again, but this time between linea glutea anterior and inferior. So this is anterior and this is inferior, and this is where it's going to lie, as you see in this picture. And it's going to insert at the Trocheanter major. And the function of this muscle is to abduct the femur and also rotate it internally, externally, according to which fibers that are contracted. Now the next muscle is tensor fasciae latae. It's going to originate at the spina iliaca anterior superior, as you see here, spina iliaca anterior superior, and inserts at tractus iliotibialis again, which I mentioned when I talked about gluteus maximus. And its function is to tense the tractus fibers. This is the muscle, tensor fasciae latae. And here you see the tractus iliotibialis, and when these muscles contracts, it's gonna tense these connective tissue, this fibrous tissue, and also it's gonna support flexing of the femur. And the next muscle I'm going to talk about is Musculus piriformis, which is going to originate at the anterior surface of the sacrum, as you see in this picture, more specifically at the lateral side of the foramen sacral anterior. So these are sacral, foramen sacral anterior, right? 2 to 4 is going to originate at the lateral side of them here. And it's going to insert at the Trocheanter major. And the function of this muscle is to abduct the femur and also rotate it externally. And I also want to talk about one thing in this muscle is the piriform syndrome. The piriform syndrome is that when this muscle is not really used a lot, when the person is not used to moving a lot or sits on the sofa a lot, this muscle will get tense, and right underneath this muscle passes a really big nerve called ischiatic nerve, which supplies the muscles of the leg with nerves. And when this muscle is tense, it presses the nerve towards the bone, and that causes pain to the posterior aspect of the pelvic girdle and the leg. And in order to prevent that is stretching out. This is one stretching method to stretch this muscle. So the next muscle I want to talk about is the obturator, musculus obturator internus and externus. I'll start with internus. So this one originates from the inner surface of obturator membrane. So if you remember in anatomy again, this is obturator, foramen obturator, and you have a membrane above it, or on it, and it's going to originate from the inner part of this obturator membrane, as you see here, and it's going to go up here and insert at the fossa trochanterica underneath the greater trochanter. And the function of this muscle is to rotate the femur externally. And the next muscle is obturator externus. This one is the opposite of internus. This one's going to originate from the external surface of the obturator membrane, and it's going to insert at the fossa trochanter. And this one's going to rotate the femur externally. The next one is musculus gemellus superior and inferior. Musculus gemellus superior is going to originate from spina ischiadica as you see here, and the Musculus gemellus inferior is going to originate from the tuber ichthyodicum, as you see here. And they both have a common insertion point, which is fossa trochanterica, and also a common function, which is going to be rotate the femur externally. So this is this is gemellus inferior, and this is gemellus superior. All right. Going over to Musculus quadratus femoris. Musculus quadratus femoris is right here in this picture. It's going to originate from tuber ichthyodicum and insert a crista intertuberale. And the function of this, I think you can kind of imagine the function of this when these muscle fibers contract. It's going to rotate the femur externally this way, and also going to adduct the femur to the midline. Now that we're done with the muscles of the pelvic girdle, we're going to go over to the muscles of the thigh. So the muscles of the thigh provide and maintain walking. The anterior muscle group is going to mainly consist of extensors, and the medial muscles are going to be mainly adductors, and the posterior is going to be mainly flexors. So go over to the anterior compartment of the femur. The anterior compartment of the femur is going to be Musculus quadriceps, which is going to be 4 muscles, there's the name, and Musculus sartorius. So we'll start with Musculus quadriceps. Musculus quadriceps can all have a common insertion point and a common function, but different origin points. Here you see the quadriceps. So we'll start with the Musculus rectus femoris. Musculus rectus femoris is this one, the most superficial one. It's going to originate from spina iliaca, anterior, inferior, as you see here. And then you have vastus, Musculus vastus medialis, it's going to lie on the medial side here. This one's going to originate from linea aspera. If you remember where linea aspera was, it's on the posterior side of the femur, more specifically the labrum medial. Remember, linea aspera has 2 lips, medial and lateral. And next one is Musculus vastus lateralis, which is this one. This one can have different origin points. One of them is linea aspera, labrum laterale, the lateral lip, and also Trocheanter major and linea intertrochanterica. And then Musculus vastus intermedius. This one's going to lie right behind the Musculus rectus femoris. So if we remove it, you will see it here. And this one's going to originate from the anterior surface of the femur. And the insertion point of these muscles is the ligamentum patella, as you see here. The ligamentum patella is going to then insert at the Tuberositas tibia. And the function of this muscle is to extension of the crudis. Crudis is your leg, so extend the leg, and also flex the femur. And don't get confused on this one. So if you look at this picture, the thigh, when the thigh flexes, it goes forward, and extends it goes backwards. But the lower part of the lower limb, when the knee or the leg flexes, it goes backwards, and when it extends, it goes forward. Same with the foot. So next muscle is Musculus sartorius. Musculus sartorius is going to originate from spina iliaca anterior superior and insert at Tuberositas tibia, at the tibia. And this one has different functions. You can see the muscle here. It flexes the femur forward and also flexes the crudis backward, and also rotate the femur externally. It's gonna originate here, so it's gonna rotate externally, and also rotate the leg internally. So now going over to the medial compartment of the femur. The medial compartment of the femur has 5 muscles. You have Musculus pectineus, you have Musculus adductor brevis longus magnus, and musculus gracilis. So I'll start with Musculus pectineus. Musculus pectineus is going to originate from ramus superior and pectinosis pubis. So this is ramus superior and pectinosis pubis here. And it's going to insert at linea pectinea femoris, right about on the other side actually. And the function of this muscle is to flex the femur. This one will adduct the femur to the midline and also rotate the femur externally. So when they contract, it's going to rotate this way. Next one is musculus adductor brevis, longus, and magnus. They all have common insertion point, also common function. Musculus magnus is going to have a little more functions, but they have different origin points. We'll start with musculus adductor brevis. This one's going to originate from ramus inferior osis pubis. It's going to be this one. You can really see it from this picture, or maybe, yeah, here it is. Inferior ramus inferior osis pubis, and longus and adductor longus is gonna originate from ramus superior osis pubis, which is gonna be here, this one, and also the musculus adductor magnus gonna have different origin points. You can see this biggest muscle here. This is the magnus. It's gonna originate from ramus inferior osis pubis, and also ramus osis ichi and tuber ichiadicum. And the insertion point of these is going to be linea aspera, labrum mediale. Remember I talked about linea aspera on the back side of the femur, the medial lip. That's where they're going to attach. But the magnus is a big muscle right here. It stretches the whole femur. This one's also gonna insert at the epicondyle mediale, as you see here. And the function of the brevis and longus is gonna be flexion of the femur and adduction of the femur, the midline, and also rotate the femur externally. While the magnus is gonna extend the femur and adduct it to the midline, also rotate the femur internally. I'm going over to musculus gracilis. Musculus gracilis is this muscle right here. And this one's going to originate from ramus inferior osis pubis, as you see here. And it's going to go all the way down to the Tuberositas tibia. And this one's going to adduct the femur to the midline, flex the femur, and also rotate the leg internally. Now go over to the posterior compartment. The posterior compartment is going to consist of three muscles: musculus semitendinosus, musculus semimembranosus, and musculus biceps femoris. So don't get confused by the musculus biceps brachii. All right, so we'll start with musculus semitendinosus. Musculus semitendinosus is going to originate from tuber ichiadicum and insert at the Tuberositas tibia. You will see it here. This muscle is musculus tendinosus. This muscle here is gonna extend the femur backwards, also flex the cruris, also backwards. Remember, flexing the leg is going backwards, extending forward, opposite of the thigh. And so also gonna rotate the leg internally. And it inserts. Here is a picture of how it's originated, just so you get a brief picture of the muscle. I'm going over to musculus semimembranosus. Musculus semimembranosus is gonna originate from tuber ichiadicum again, and insert at the condyles medialis of the tibia. And the function of this muscle is extension of the femur, and also flex the leg and rotate the uh, leg internally. Now the last muscle of this video is the musculus biceps femoris. Musculus biceps femoris is going to have two heads, hence the name, biceps, just like the biceps brachii. Caput longum is going to originate from the tuber ischiadicum, as you see here. That is why this one's long, hence the name. And you have caput breve. Breve means short. So the short head is gonna originate from labrum laterale, linea aspera. If you remember, we talked about linea aspera on the posterior side. This one's gonna originate from the lateral lip. And they have common insertion point, which is caput fibula, the head of the fibula. And the function of this muscle is to flex the leg backwards, and also rotate the leg externally, and also extend the femur backwards. So that was it for this video, and hope this was helpful.